Hi, I'm B News producer Sydney Bowles, and I'm here to talk about a seasonal issue that comes up around this time every year, flu shots. This is something that you may have seen around, you may have already gotten yours, and if you haven't, here's your reminder, make that appointment. But to talk about the who, what, where, when, why of it all, I'm here with Director of Public Health Susan Lumenello to get the details. Susan, thank you so much for joining me.
Thank you for inviting me, Sydney.
So, first things first, I feel like something happened this year. It's the first year where it feels like we're getting the flu and COVID shot around the same time. Have we reached the point where this is going to be what it is now, where it's kind of, it's fall, time to get your flu and COVID shot, and that's just the way it is?
Yeah, so yeah, we are moving towards that because we are no longer, COVID-19 is no longer a pandemic, it is now endemic in our lives and in our communities. So the COVID vaccine is going to be offered every year, and we do recommend that people get it. If you're 6 months to 4 years old and you haven't received it yet, then parents should think about talking to their pediatrician, and the recommendation for those children is to get 2 doses. For everyone over the age of 5, the recommendation is to get the 1 dose.
Okay.
And if you're immunocompromised, again, you should talk to your doctor. You may need to get the 2 doses.
And that's kind of for everyone, whether maybe you missed the last booster, whether you know a variety of circumstances. Now it's just kind of your one and done kind of thing.
Yeah, because it's the formulation, so
Yeah.
you may not have gotten the current formulation that's out now. So it's similar to the flu. That's what they're looking at, the strains that are out. That's what they do with the flu. The flu vaccine changes every year, and I think what we're going to move towards is that the COVID-19 vaccine is changing every year, and the formulation for the vaccine will change.
I just want to take a moment and appreciate how amazing it is that we have the science for this, that we made it through some really pretty horrifying years there, and we've gotten to this point of relative stability, it seems like.
Yes, and I think the important thing for people to remember about COVID is that there's testing for it, so people can get free COVID-19 testing from the government. They're giving 4 tests per family, so if you just Google U.S. free COVID vaccine testing, you will be able to sign up and have them delivered to your home like during the pandemic. So people should do that, because if you do think you may have COVID, it is always beneficial to test and find out if you have it, because there's viral treatments for it now as well. And the state has a telehealth site, so you can Google Massachusetts COVID-19 telehealth, and you can, if you test positive for COVID, you can have a telehealth appointment, and they'll be able to prescribe antivirals. Paxlovid is one of those. Or you can certainly call your doctor's office as well, where they can prescribe it as well.
And then I kind of feel like most people probably are on the same page about this, but maybe we should just talk about it. What's the procedure if you do get COVID and you're feeling a little sick, not that sick? You should probably stay home. Should you wear a mask if you need to go out, or should you not be going out at all?
So the recommendations for that have not changed. If you test positive for COVID and you're symptomatic, you should stay home until you're no longer symptomatic. And then when your symptoms resolve and you go out into a public setting, you should wear a mask for 5 days after that. Those are the current recommendations right now.
Perfect. And then just to go back to the shots for a minute, should you get them both at the same time, flu and COVID?
You can get
same arm, different arms?
You may want to get different arms, but you can get them at the same time.
Cool. All right. I want to transition to the flu shot because this is something that your department, your office has been working on pretty intensely. But before we get there, I feel like I want to tip my hand a little bit. I feel like when I was growing up, the messaging that I got about the flu shot was, if you're older or if you're immunocompromised, this might be something that you want to think about. But if you're healthy, if you're younger, you're probably fine. Now I feel like the messaging is different, and the messaging that I've been hearing is mostly probably pretty much everybody should be doing this. So has the messaging changed, or was that just like my idiosyncratic experience?
Yeah, I think maybe younger people think, well, if I get the flu, it's not going to be that bad.
Right, yeah.
But that may not necessarily be the case. And who wants to have the flu?
Right. If you can avoid it, you might as well. Yeah.
Right. So the recommendation is everyone 6 months or older. If you're over the age of 65, you should be getting the high dose vaccine, and we have that available at the Board of Health. We're having a clinic tomorrow, and we've had people sign up, and we're giving out 50 of the high dose vaccine. We've already given out quite a few doses already.
So for listeners, that's tomorrow. This is Friday the 13th as we're recording, so that's the 14th that clinic is going to be.
Right, and at this time we have no more high dose available.
Okay.
We have regular dose available. So if you're over 65, you should get the high dose, and you may not be able to get it at our clinic tomorrow, but you should find someplace else where you can get it.
Okay. Susan Lumenello, Director of Public Health, you've been doing a lot of work. Your office has been doing a lot of work around flu shots in the community, but also with the schools and with shots that are not flu shots. So will you tell me a little bit about the work that you're doing specifically in the schools with vaccines?
Yes, so we've collaborated with the Burlington schools, specifically with Barbara Conley, the lead nurse at the schools. We've been working very closely with her because it's her responsibility to make sure that all the kids receive the required vaccinations for school.
So that's not flu, that's stuff like Tdap, MMR?
Tdap, chickenpox, MMR, polio,
Mm-hmm.
those types of vaccines. Yeah, the required vaccinations to enter into school.
Okay.
So there's quite a few students now who need those vaccinations, and we have the ability to do it, the Board of Health, because we participate in the Vaccine for Children program through the state, and we have been doing that for years. Our nurse has always vaccinated children who are uninsured or underinsured. So if you have no insurance and no means to get vaccinations, we provide those. So we get our vaccinations from the state through the Vaccine for Children program, and then that's how the Board of Health office administers them. So we are planning on doing a lot of vaccinations next week at the high school. We have a mechanism, which is a software program, which we get from the state, where we can enter in the vaccines, make appointments, check records, and once we give the vaccines, it automatically goes up to the state database called MIIS, so that there's a permanent record of the vaccinations that the children are on immediately, and then it will go to any healthcare providers that see them in the future.
Because this is something that a lot of communities are dealing with. We've seen a significant number of families with migrant backgrounds coming into Burlington who maybe don't have the records that they might need. It's unclear maybe what shots they've gotten. There are a lot of shots that you need to get. You can't do them all at once. Is this sustainable for the Board of Health? Are there more resources that you wish that you had, or do you feel like you're in a good spot to help these kids get up to speed?
I really do feel like we're in a good spot, mainly because of the recent changes in public health in the state, where we have entered into the shared services agreement with Lexington and Wilmington, and that allowed us to hire a lot more staff. So we have part-time nurse in that office, as well as somebody who can interpret for us, and so that has helped a lot. The staff in that office, and so I think that right now we're trying to do a little bit of catch up, but once we get there, we will be able to sustain this. And also there's the alliance that Burlington and Woburn is doing,
the
where
Welcome Alliance
the
Clinic
Welcome
with
Alliance,
us,
yeah. They're providing physicals for the children, because we feel it is important not just to give vaccines, but also to have a physical as well. So they're providing the physicals, and we are assisting with the vaccinations.
Great. So there's a lot of resources out there, it sounds like.
Yeah.
We've gone a lot of places in this conversation. We've talked about flu shots, COVID shots, and sort of your school-age vaccine regimen. Before we wrap up, I want to sort of give you one last chance to talk to folks in the audience about the flu shot specifically. Make one last case for setting up that appointment.
Yeah, so it's easy, it's quick. We have them available. You can call the Board of Health office if you want. I'm sure after this clinic that we have, we're likely to have some regular dose left over, so we'll be doing additional clinics. So yeah, we encourage everybody to get their flu vaccine and your COVID vaccine as well.
Awesome.
Yeah.
Susan Lumenello, thank you very much.
Thank you.